Good evening. My name is Sue Buck, and welcome to this forum for the Portage County Executive. I'm a member of the League of Women Voters of the Stevens Point area, and I'm pleased to serve as the moderator for this forum. The county executive is responsible for the leadership and coordination of the work of the Portage County government, providing services to the more than 71,000 residents and 27 municipalities of the county. These services include highways, parks and trail systems, and protecting the public through the public safety departments. The county also provides services to children, elderly, and disabled citizens through the Health and Human Services Department, the Aging and Disability Resource Center, and the Division of Public Health. It is the mission of Portage County government to enhance the quality of life for all its residents by providing fiscally responsible services that enable the citizens to build productive communities, families, and lives. The 2018 budget for Portage County is $103,874,702. $2 is really important, so we don't want to forget that $2. The position of county executive is held for a 4-year term beginning April 17th of this year. The county executive salary for 2018 will be $84,510.51. We appreciate that 3 candidates for this office are present with us tonight: Jamie Gabert, Chris Holman, and Matt Jakowski. In order to provide the most time to hear from the candidates and to provide a fair and equal opportunity to answer questions important to you and this community, I will briefly review the format for the time and terms of the forum. And these have already been reviewed with the candidates. Each candidate will have 1.5 minutes to introduce themselves and make an opening statement. They will have 2 minutes to respond to questions, and I will repeat the question if you need me to do so. Candidates will respond first to some questions submitted by the League and then questions from the audience. Questions from the audience must be addressed to all the candidates. If you want to submit a question, please motion to one of the ushers for index cards and pencils. And where's our ushers so you can see where they are? Okay. If you want to ask a question. The League reserves the right to review and screen questions for relevance and to avoid duplication. The order of response to each question will be rotated. We will alternate which candidate answers the question first. The order of opening statements will be chosen by random drawing. I have my handy little drawing bowl there. And we'll get started with the forum. As I've already stated, participating in tonight's forum are Matt Jakowski, Chris Holman, and Jamie Gabert. As we now begin the 1.5 minute opening statement, and we will start with Jamie Gabert.
Thank you. Good evening. I'd like to say thank you to the League of Women Voters for hosting tonight's forum. Thank you to community media for broadcasting the event. And thank you to everyone that's in attendance tonight. This is a great turnout of people wanting to learn more about the executive candidates. I have a quote on the screensaver of my computer, and it says that leadership is not about being in charge. Leadership is taking care of those in your charge, from Simon Sinek. I share the quote this evening because I'm not running for county executive because I want to be in charge. I'm running for county executive because I believe in building community through service. As a lifelong resident of central Wisconsin, I have been fortunate to be raised on a family farm, to be a UWSP graduate, and to be an active community member of this great Portage County, a county that I love. What uniquely qualifies me for the executive position is that I am the only candidate who has over 10 years of local, directly related government administration experience, with 8 of those years being in the county executive office. County government is complex, as we've heard, because it encompasses an amazing spread of services, programs, and missions. And while all 3 candidates bring a different approach to the executive office, I am the only person who can guarantee meaningful work on the first day, on day 1. As executive, I will take care of those in my charge, and I will always be open to input, new ideas, and constructive feedback to continuously make Portage County better. Thank you for the opportunity this evening.
Thank you. Chris?
Okay, good evening. People ask me why I'm running for this position, and it's kind of funny in a way, but I'm running for the position for the same reasons that it was created in the first place. 12 years ago, people in the county saw what they called a good old boys club on the board, and they wanted a check and balance on that in order to better serve the county. Things were, in their estimation, dysfunctional. I've met with the people who put the position on the ballot, and they hammered this point home in our conversations. Unfortunately, or probably fortunately, there's not another position that we can create to provide some oversight to what we have now. So I'm running because I know I can provide a check and balance on where we are at in the evolution of our government with the board and executive. Now, any board or executive is going to have their ups and downs, but for me, the heart of the matter is that for many reasons, there has been an inability for these two entities to see eye to eye often enough to provide a stronger framework for the county to work and progress in. We're feeling the repercussions of that right now. To give you an idea of where my campaign is coming from, this morning I attended a meeting where the bulk of the conversation focused on the idea of providing leadership to county committees, department heads, and staff in order to give them direction so they can better do their jobs. The discussion also talked about routinely looking at how we address long-term thinking so that the county can set priorities beyond the day-to-day services that the county provides. One committee member mentioned that there is a strategic plan with some set of priorities identified in it, but they went on to say that those priorities are not prioritized. These ideas were brought to the committee because of budgetary concerns, but for me, it highlights part of my vision and why I'm running. These ideas are common sense to me. They should always be in place, and I'll push for them and others on day one. This is what I mean when I talk about getting the county back on track. We can do better, and we should.
Thank you. And Matt Jakowski?
Good evening. I'd like to thank the League, the local media, and most importantly, all of the citizens that showed up here tonight. Thanks for being involved. I'm a lifelong resident here in Portage County, an educator, a Portage County board member, a farmer, and highly involved with children and families within our community. I'm not just here to solve problems. I'm here to help Portage County grow and prosper. Educating our children and creating a strong workforce is a component that sets me apart from my competitors. This will help our children, our families, our local businesses, and our community move forward together. We need to work together to solve complex issues. My voting record shows that I listen and I care. As a result of my employment involvement, I am the most qualified candidate with a broad base of experiences and knowledge in all areas, just not hot-button topics or critical issues. Along with my wife, Kimberly, I want to make Portage County a place for our three children to grow up and enjoy the values, resources, education, and support networks and recreational opportunities that set us apart from our neighboring counties. Thank you.
Thank you. We will move on to the first league question, and we'll begin with Jamie Gabert. And the first question is, in light of the recent groundwater quality sampling project of the Groundwater Citizens Advisory Committee in 2017 that showed almost 25% of the drinking water wells sampled had nitrogen levels that exceeded the state drinking water standards, how would you balance the needs of all citizens and the protection of the natural resources, specifically groundwater?
Thank you. This is a great question. The water sampling project that came forward actually was an initiative out of the county executive's office. We put $25,000 in the budget to have that be a partnership through the university to do a grid sampling of the county so we could have baseline data. The results of that study in totality are going to be revealed at the February 20th county board meeting, which I encourage people to attend. And then additionally, we have set up 4 informational sessions around the county to talk about what those results mean. The county executive's office put forth a call to action to the Planning and Zoning Committee, the Public Health Department, to say, now that we know that we have such a high nitrate count, 24% in our county, which is 2.5 times higher than the state average, which is 9%, what could we do about it? What are immediate actions that we could take? And one of the great inputs that came forth was to work through the Planning and Zoning Department, where a citizen, if they had a high nitrate test, would come in, bring in their water sample, we would verify it with our groundwater specialist, and then we would work with our conservation department to go out and try and facilitate something neighbor to neighbor to say, this is the area of concentration where we can see where that nitrate is coming from. How can we maybe negate having so much nitrate flow this way? We have great science here in Portage County that can help us pinpoint these locations and hopefully work through it neighbor by neighbor. If we can't, then we need to step up with regulation, and that possibly could be through an ordinance or through other planning and zoning methods. Another piece that was in that call to action that they had put forth was maybe even doing separate zoning based on soil types as a more of a long-term solution to help the problem. But we should continue with this water sampling project that we have done and continue having money in the budget in order to do it on a 5-year rotation so we can see through analysis, through science, if our groundwater quality is getting better here in Portage County.
Okay, thank you. Chris Holman.
Sure. I think we should pursue everything we can at our level. And at the last forum, I talked about how frustrating it can be for the county to have its hands tied by state law, in the sense you can't regulate stricter than state laws. Volunteer programs are great, but it kind of accentuates that reality. It's kind of the best we can do. And there's nothing wrong with that, but we need to do all of that and more in terms of what we're capable of doing at our level. The regulation piece, I think we have to be very careful about, because stressing preventative is more important to me, because once you start getting into punitive measures, you could trigger lawsuits, you could get other entities out there with far more lawyers and money than the county has. And it's not to say that you shouldn't put up a good fight if there is a fight to be had, but you need to do your homework and make sure that you don't lose it, because there is precedent in the state where municipalities have done this, and then what ended up happening is the state got wind of it, nipped it in the bud, rewrote the statute, and threw every county's authority under the bus for those situations. So you don't want to do that for water. There are instances within the county where we have specific abilities to kind of work beyond where the state is at, or focus on more stricter things like in wellhead protection zones. But for me, it's really about local control. So in my role as county executive, what I would want to focus on is going to that county's association, which we're a part of, and asking them to do their damn job. In that sense, I know that counties have different interests, but local control is one that we all share. And for the last 20 years or so, the counties association has kind of acquiesced as the state has taken more and more and more of our ability to solve our own problems. So that would be one angle I would want to pursue. Another angle I think would be interesting to try would be to approach our neighbors, go down Central Sands area, Marathon County, everybody who's kind of sharing a similar concern, and go into like a regional lobbyist. We could cost share it so that we have somebody at the state level who's arguing on our behalf for the laws that we don't have any effect on. And that way we have a voice at the state. I could be a voice at that state as well, but it's a new tack in terms of making those arguments.
Okay, thank you. And Matt Chakowski.
I was glad to see when the county executive's office came to do a water test throughout the county, because it was very hard for us to find information prior to that. It's very hard we maybe had a well here or a well there. We didn't know whose wells they were. We didn't have a representative sample throughout the county. Now that we have that, we have to work together. We can't just come with a regulation and say, you need to stop this, you need to do that. We know it was you that caused this. Because it's very hard, and the professors at the university have even said when they've spoken, it's very hard to tell exactly, to pinpoint exactly where that nitrogen comes from. We need to look as a group, as a neighborhood. One of the examples that I see that works very well is right now the Friends of Mill Creek and the farmers of the Mill Creek watershed work very well together at doing different practices, putting best management practices into place. They work with people all the way up and down the Mill Creek watershed. And I understand that's a surface water group over there, but there's no reason we can't take what that group does. Everybody's sitting around a table, people from farmers to business people. They even invite the people from Petenwell and Castle Rock flowages because it has an effect on them, what goes into that surface water. There's no reason we can't take that and mirror that for groundwater groups. Get everybody in the neighborhood together. Maybe you'd have a Elm Flats group. They would get together. Maybe there'd be a Plover group that would get together. But what it comes down to is neighbors working together, sitting across the table from each other, not pointing a finger. That's what's going to get things done. Everybody coming together.
Okay, thank you. Our next question, we will start with Chris Holman. A difficult decision regarding the future of the Portage County Health Care Center will soon need to be made. What are the advantages and disadvantages of retaining the facility as a public entity? What factors and pressures will you consider in making a decision?
This is a really difficult situation. It's, there's a lot at play. I think the reason everybody's so frustrated with this is because we have values that are in conflict. And it's, you look at something like fiscal responsibility that people say generally is a good thing, but valuing taking care of people is also a good thing. So how can you kind of balance those out? Now, in terms of the advantages, we know that the services there are top-notch, but the issue you're having is that it's been operating in a structural deficit for some time. And so throwing $1 million to $1.5 million into the facility that we have now is not a long-term answer. In fact, 2019, we're going to be transitioning that facility into a new reality no matter what happens. It could be new building, could be some other sort of thing, partnership, whatever. But we need to prepare for all those possibilities now. Part of the, we talked about the budget. In terms of $103 million, we don't really control 2/3 of that budget. We only have control maybe or flexibility with $33 million. Of that, the operating levy is only $23.5 million. So people talk about spending the reserves, but there's a county ordinance that completely defines how you spend funds. And it's 3.8.3 if you want to look it up. And what it says is that you can't spend reserves on operations, and that's what we've been doing. If you continue to do that, you lose your bond rating, and the bond rating goes down, and that complicates long-term borrowing for any other project that you want to do. So, the reserves are not the option that people should be looking at. They're there for a reason, and this is going to require a lot of different sort of thinking. The Schenck study told us as well, that the operational side is the big key. Even if you have a new facility, you have to answer how you're going to operate it. And for me, the 2018 budget is a one-year notice to the people who are not going to be a part of that future, even if there was a new facility. All the staff are not going to go there, so those people should be thinking about what they're going to be doing. That's just the hard reality of it.
Thank you.
Okay.
Matt Chakowski.
Can you repeat that question for me, please?
Sure, I sure can. A difficult decision regarding the future of the Portage County Healthcare Center will soon need to be made. What are the advantages and disadvantages of retaining the facility as a public entity? What factors and pressures will you consider in making a decision?
Well, the advantages of it, and it's already been alluded to, is the quality of service that happens there. And I'll tell just a quick little story about that. We had a family friend that spent some time there, broke his hip while he was there, had to go to a hospital, went to the hospital. When he was coming back, transitioning out of the hospital, there wasn't room for him at the Portage County Healthcare Center. He was in another facility for a short amount of time. When he came back to the healthcare center and we were visiting him there, he told me if I ever have to go to that other facility again, drag me out back and shoot me. So our quality of care is one of the great advantages. The disadvantages that we have right now is we're running $1 million a year deficit, and that's not sustainable. We can't keep doing that. There's a survey that's going to be coming out here shortly. We're going to have a statistically valid survey as the county, and we're going to see how the people in the county feel. We need to take that survey to heart and follow it. We've done other referendums and things throughout the county, and then 61% of the voters decide one way and the leadership in the county decides to go the other. We need to follow how the people feel in the survey. And then we need to start looking at how do we make this county home sustainable? Is it building a new building, remodeling the current building, getting rid of some beds, maybe going to 70 beds, 60 bed? We have to find that magic number. There are counties out there that run county healthcare facilities and are successful at it. We don't need to reinvent the wheel. We need to start having those conversations with those counties. What are they doing that we aren't? How can they make it operate? We need to look at the private sector. How do they make theirs operate? They're doing it for profit. We maybe don't have to do exactly what they do because we don't need to make a profit on it. If we can run it as a revenue neutral system, there's ways to do it out there. We just need to get everybody together again, work together on it. We have to go with the wishes of the people of the county. Thank you.
Thank you. And Jamie Gabert.
Thanks. Certainly, the advantage of us having the healthcare center is that then we control its future. I think one of the biggest advantages of us having the center is the proximity of the beds to us. You don't have to travel, and if you have a loved one, the proximity of the beds are right here and local. That's one of the biggest advantages. talking about the survey, I had put forth the idea of doing the survey because if we do just a referendum question, we only get to ask one question, and it's a yes or no. And you don't know why people voted yes or no. Was it because it was too expensive? Was it because they don't intend to use the service? So having the survey gives us a much broader perspective of what the citizens, who are the potential customers of the healthcare center, feel and what they want to see for the future of the center. I actually called the 6 research centers and presented that just last night at the healthcare center, and they did decide to go with St. Norbert's College, who's going to be doing a phone survey. I say that because if you get a phone call, please answer it and provide your feedback to them on how you feel about the future of the healthcare center. If we do continue on with the center, we will have to put in levy. And I think a big question is how much levy are we comfortable as a community adding to the healthcare center, which I think will be a potential question through the survey. But I don't know that it is sustainable all by itself. I think that we will have to put in levy to supplement that. And I think we need to make the decision as a county what that potential number could be. But we need to build in, whatever the future is, we need to build in the sustainability for that long-term upfront. And if we do build a new facility, we need to make sure that it's sustainable long-term so we don't have to revisit this conversation in the future.
Okay, thank you. Our next question, we'll start with Matt Jakowski. And the question is, the county will be facing a number of difficult decisions in the upcoming months on issues like the healthcare center and the jail and the possibility of Portage County potentially facing tough budgets ahead. How do you see Portage County planning for or addressing these increasingly difficult discussions and decisions?
We've already started that process. I see Director Schuler's here tonight, a little shout out to him. He's already started asking all county, he started in his own department, the planning and zoning department, and to start prioritizing these strategic plans. What is most important to us? What is most important to the staff? What is most important to the people of this county? That's what we need to look at. I'm a little disappointed that the county decided to go ahead with a building project that was turned down by 61% of the voters. We just took and transposed the numbers from an $87 million project to a $78 million project and went forward with it. That didn't solve the biggest problem with our building, and that's our jail. We're spending close to $1 million a year shipping inmates outside of Portage County. If we would have went with the jail project first, we would have had the opportunity to recoup that $1 million and help pay for that building project. We have to sit down and listen to the citizens. We need to know what your top priorities are. The way the budgets are getting, we can only increase our levy by as much growth as we have per year. So we're looking at around a $300,000 increase a year. If we have a good year, maybe a little more. But that's not a lot. All of you know the cost of everything goes up. Every time you turn around and go to the store, something goes up. Shipping costs are starting to go up. Fuel's starting to climb again. Those are all things we have to pay for as a county. If we don't get a big enough increase, we have to start looking at what can we live without, or what can we pare down? How can we do the most with the least amount that we have?
Okay, thank you. Jamie Gabert.
So in this county executive administration, we did put forth the effort to do the strategic plan, which was approved by the majority of the county board and then was revised and approved again just this past year. I know that there was comments made earlier about comments on that strategic plan, but I would just say after 8 years of being in the executive office, I don't think one meeting is an accurate representation of the effort that we put into that strategic plan and the importance that it took to get that in place for the first time for the county. So using that strategic plan, we would work with departments to determine what the priorities are and develop work plans. We have started the conversation about doing more long-term planning with priorities, which I think is going to be important. Much of the services that the county provides are mandated services, but I think we need to talk about at the level of which they are mandated. We are a level 3 public health department. Do we need to be a level 3? No, we are mandated to be a level 1. But what do we lose in the difference? I think that's the larger conversation that we need to have now with all of the departments in order to set priorities. But I also think another big piece of this is our capital plan. We have a capital plan that we had redone in 2013 to make it much more user-friendly, both for departments and for people that would be reading, citizens that would be reading the capital plan. But now we need to really put in the effort to say, in the next 5 years, these are the things over $25,000 that we plan to do, and really put a lot of effort into putting good estimates and work and research into those numbers, so we know when those expenses come up, that we've planned for them and that we do need them to happen for the county. That's both with infrastructure that is just general maintenance infrastructure, like our chillers and our HVAC, but also with these building projects that we're talking about with the healthcare center or the government facility building.
Okay, thank you. And Chris Holman.
Okay, yeah, so every year we start the budget process with the same question, or same problem, really. There's not enough money in the budget. So the cost of doing business goes up, the levy brings in as much money as it does, and there's that gap between the two, and you have to figure out where are we going to address that. So far, we've been able to do a pretty good job of that, but we're at a point now where we're going to have to start asking ourselves, what levels of services do we want to offer, or do we want to forego services, or are there other steps that we're going to have to take because of this reality? It's, it's out of our hands in large regard. Really, I think the new board, there's going to be a tremendous amount of turnover in county leadership, and so that new board is going to need training. They're going to need education. They're going to have a lot of stuff land in their lap when they sit down in those chairs for the first time. 7 of them will be for the first time ever. And so it's going to be a pretty heady time for them, and I hope they're doing their homework now, wherever you are at. But it would be interesting to me at a department level, but also as a board, to say, let's sit down and together, independent of one another, prioritize these things and then compile the results to see where do we stand as a body, and then use that as a tool to work forward in terms of just giving an input to start the conversation. And it's not that these are insignificant issues either. I mean, we just talked about the healthcare center. If you're talking about $1 million to $1.5 million, it's going to have to go there. You're going to pull the levy from that. That's not 1% of $103 million. That's about 4.5% to 6.5% of the operating levy that we have to work with. So it's a pretty sizable chunk that you're going to rob from Peter to pay Paul. I'm not saying you shouldn't do it. We can talk about it, but that's the reality of it. It's not just a simple transfer of $1 million. But the salary study is another example. Last year we implemented the salary plan and it worked because healthcare costs dropped by 13%. I don't know how long we can count on healthcare costs dropping every year. So already heading into the next year, year 2 of the salary plan, there's not enough money to cover this money we're going to have to pay people to implement year 2 of the plan. So, I mean, that's just 2 of many situations where you're going to have these things to grapple with.
Okay, thank you. Moving on to our 4th question, we'll start with Jamie Gabert. The Life Report of the United Way says the most significant problem is the lack of mental health and substance abuse services. What would you support increases in the number of mental health professionals employed by the county?
Thank you. The state also has put an emphasis on mental health issues. And so the county was fortunate actually to receive just over $900,000 for comprehensive community services. There are a lot of acronyms in Health and Human Services, so sometimes referred to as CCS. So we were actually able to add 5 staff this year to deal with mental health issues. The hope is that that funding would continue through the state. If that funding would not continue through the state, we would have to find other means inside Health and Human Services for those CCS workers. And what they really do is for individuals that have mental health needs, they help them get assimilated back into the community. They help them with job skills, they help them with social skills, they help them with finding social circles that can support their mental health needs. In addition to that, the county also has the Rock Point House, which I don't know that a lot of people know that we have. It's on Jefferson Street. It's a drop-in day center. So people with mental health that might be struggling on a day or might need extra supports can go to Rock Point and get help. There's people there. They can cook a meal together. They can spend time together. They can work on projects together. I know at a department head meeting, we actually ran a collection and got puzzle books and cooking pans in order to take to Rock Point for people that have mental health needs. But I think that we're grateful that the state put an emphasis so we could add the staff this year for those positions. And those positions also will be focusing on AODA, because a lot of times those are not mutually exclusive issues. They fall together with all of the calls for action in the life report. They all run together. You have mental health issues, and maybe then you have AODA issues, which cause financial stability issues, and then you might have issues with finding housing. So it really is a cycle that we need to break.
Thank you. Chris Holman.
Sure. It's HHS is an interesting world. It's a state program that the county runs, and so even though, and I said it in the last forum, Ray Schabelsky is working all kinds of magic in his world, I think it worries me a bit because the state's involved. And right now, we manage to do pretty well with everything that we're required to do, but they could change their mind. And if they do change their mind, then we, generally speaking, most of the time it's mandatory programming. We have to cover those bases if they start shifting how they want us to behave. So, if we're adding personnel and we can do that, that's great. But, adding more personnel on top, you still have to ask that question again, can we afford it? That question, I think, would be something you'd have to ask Ray. Nobody in this county or probably in the state knows more about HHS than him, especially his department. So, in the event that you can't continually add more personnel into HHS to cover all of the needs, I think it's important to go to the people who are there and who are doing the work, because it's incredibly difficult. And, morale, I think, is kind of low on that line worker level where they're grappling with all these things without a lot of resources and without the extra help that they might need. Now, if we've got extra help this year, excellent, and hopefully that continues. But it's something that I think, the fiscal side of it is certainly a reality. It doesn't matter what business you run, labor is a huge chunk of expense. And HHS already is this complicated web, framework of private services and public stuff, and a lot of programs there are grant funded and they support themselves. So it's working really well, and obviously, the simple answer to your question is yes, you want to support these things, but the realities underlying it, and then so many things being out of your hands, kind of, you kind of have to see. You can't necessarily predict what's coming in some cases.
Okay, thank you. And Matt Jakowski.
One of my elders once told me, an ounce of prevention is worth a pound of cure. When you're dealing with mental health and AODA issues, it is very important to fund that to the best that you can. Because if you don't have the support for the mental health or the AODA issues, we end up dealing with it on the cure side. We end up dealing with it in our jail system. We end up dealing with it taking our officers' time. I didn't realize this until I went through the Citizens Academy for the Sheriff's Department, that if they deal with a mental health commitment, it sometimes takes officers up to 4 hours. That's taking 2 officers off our roads for 4 hours to deal with a mental commitment. If we put this money on the front side, we save more on the back side. Another thing we have here in Portage County that is great, we have great people and we have great safety networks. Here in Portage County, we just ran a United Way campaign that ended up close to $3 million. Little Portage County, $3 million. Our neighbors to the north, Marathon County, twice our population, they're lucky to get $300,000. The people in Portage County care. We care about things like mental health. We care about our neighbors. We care about our friends. I think there's some room for public-private partnerships in mental health. If we can't afford it as a county to provide it, there are people out there that are willing to step up and help. And some of you are right in here. I applaud all of you that donate to these things and help with that. But so we have to find that balance. I hope in the budget that we can find enough money, or that the state will keep allowing us to fund these positions, because we save the money on the backside. And that's hard to sell to taxpayers in public. We say, okay, we're going to spend this money now, but we're going to save it because we're not going to put people in jail. Thank you.
Thank you. Our next question, we'll start with Chris Holman. What are your thoughts on the recent ruling against the drainage district? Are there changes you'd like to see in oversight of these important waterways?
No, that's it's a classic case of, people who know each other very well, coming to a disagreement and then not being able to reach across the aisle and compromise, If you can't find that compromise or consensus and you land in the courtroom, it never ends well. So being able to try to avoid that moving forward is clearly what you need to do. Now, the result that Justin got from that and Lynn is a positive for them in a sense that they were well within their rights. The judge found that, the drainage districts kind of preempted the court's ruling. Now, does the drainage district have a lot of old power in this region? Yes, of course. But I think it kind of, you need people on that drainage district board who can sit down, look at a kind of broad, multi-stakeholder perspective in terms of how do we deal with not only, Justin Isherwood's piece of the drainage district, but the whole thing. There's a tremendous opportunity there for, tourism coming up there, learning about how it even works. It's a missed opportunity up to this point. So how do I feel about it? I think that I'm looking forward to seeing what Justin does when he gets it going back up again. It's unfortunate that it came to that, but that's, I don't know, I'm not sure what else I could say to it, so.
Okay, fine, thank you. Matt Jakowski,
Repeat that question one more time.
please, yeah. What are your thoughts on the recent ruling against the drainage district? Are there changes you'd like to see in oversight of these important waterways?
The drainage district in Portage County is a unique situation. It's actually, people are chosen by an Ag and Extension Committee, ranked on their qualifications, and then actually the judges in the county appoint the drainage commissioners. With the recent ruling, I think we need to put all the stuff that's happened behind us and again, work for a common goal, a common good, and have to find that balance. What is that balance? Can we do certain things in certain areas? Is there certain areas of the drainage district that a project will work in? Are there certain areas of the drainage district that a project won't work in? Between working with scientists, our university here in Stevens Point, professional drainage engineers, I think we can find a common goal for the drainage district to work with. It's kind of a neat situation because it's kind of separated from county government. It is controlled by the people that own land in that drainage district. If you're going to be on the drainage board, you have to have an interest in the drainage district. They are then, through their annual meeting, they set their levy. The people there vote to set their levy, what they're going to pay for that year to maintain the drainage district. So it's kind of a neighbor-to-neighbor thing, and it's kind of politics on a very micro level. It's where people that actually own the land have something to say about what is done with the land.
Okay, thank you. And Jamie Gabert.
I'm supportive of the judge's decision. I too look forward to what Justin does back with his drainage area. Matthew gave a good synopsis of how that works. I would also echo that he's on that Ag and Extension Committee, and so I would hope that going forward that they would elect other individuals or would entertain other individuals than the three that have been on that board for a long period of time. It is only 3 individuals that are put forth to the judge and that control that drainage district. And maybe they need to explore having it be more than 3 individuals. And I hope that Ag and Extension would forward people, although they do have to live in that district and have property in the drainage district area, would forward individuals that maybe would be in opposition to their current leadership, so they could maybe have more of a balance in conversations of listening and hearing what people that live in that area want to do with their property.
Thank you. Our next question, we'll start with Matt Jakowski. There are still a fair number of people who feel a county administrator rather than a county executive would better meet the needs of our county. How would you address this question with some of your constituents?
some of you have probably already heard me on this as we've had conversations throughout the primary season here. I believe that the county executive, when ran right, when worked right, working alongside a board, not against a board, is a good position. It provides that checks and balances. It brings a unique perspective, and it is a position that's elected by the people. We had some people reference the good old boys club. Well, if you get a county board that keeps hiring the same good old boy administrator, you don't have that checks and balance system. I think the executive position works very well for the county. I think it's worked in many counties throughout the state. And I think if we take the executive position and have it work alongside the board instead of against the board, I think it can continue to work very well here in Portage County. Also, the executive position needs to realize that they're there to run day-to-day operations and that they are not a legislative body. They do not set policy. We need to leave the policy setting to the county board. Then the county executive needs to carry those policies out in the best way possible.
Thank you. Jamie Gabert.
I think often why this topic comes up is twofold. One, the county executive position is still fairly new. It's only been in existence for 12 years. And several members of the county board still remember what it was like before they had the county executive position. But the main reason that this position is and why it needs to stay is because it was chosen by the people through referendum. The people selected to have this position to be elected by all of the people in the county, and that's why it's important. It was the people's choice. I think sometimes where we have this conflict is because a supervisor, a county board supervisor, is elected by 2,800 people that are in their district, and the county executive is elected by all 70,000. And sometimes what is best for a district is not what is best for the county. And the county executive needs to think of all of the 25 districts and all of the citizens within the county because they're elected by everybody, and to have that bigger picture in mind, what is best for the greater whole. And so sometimes those are in conflict. That's going to happen. But the largest reason why this should be an executive and not an administrator is because that's what the people chose.
Thank you. And Chris Holman.
Sure. I mean, there's lots of ways you could look at this, and I included this in my announcement letter as something that I would want to take a look at. The one thing I'd mention is that the people's choice is not fixed in time, and that was kind of my point in even bringing it up. You know, I don't think we should be scared of having a conversation about the position. How has it worked? You know, are people happy with it? Are the voters who made the choice happy with the position? If they are, great, we continue on down that line and off we go. If they're not, then we can either address the concerns, or if the concerns can't be addressed, then voters again would have to take action on their own. There's nobody at this table that could say we're going to get rid of the position. The voters would have to once again vote to get rid of it. Now, you might not realize that state statute only requires a county executive if your county population is over 500,000. So we are clearly not at 500,000. You can still opt for it, which is fine, and we did that. But we're also the smallest, population with the county executive. Does that matter? I don't know. But I think that the biggest distinction, and you heard this in the tail end of last year at county board meetings. People were talking about the compensation package for this position. We need to increase it so that we attract better candidates. Well, I'll tell you, probably the better candidates who are looking for that increased compensation package are already running cities and towns somewhere else. Then they're not going to take a shot at a 4-year position running a county anywhere. On top of that, the strength of the county administrator position, statutorily, is that it is required to be hired by merit. It's written right in there. You have to be able to do the job in order to be the county administrator. There's a clear difference for the county executive. Yes, the people elect. Yes, you can get good candidates. Yes, it can work. But you could also get candidates who aren't very good. Or you could even have people come in and take over the whole electoral process and spend, $3 million to get their person in. We see that all the time in Congress and elsewhere. So, there's lots of angles at this, but, I'm not afraid to have that conversation, and I think we should.
Okay, thank you. And our next question is, we'll start with Jamie Gabert. What are the challenges facing our current emergency medical services, EMS system, and how will you work to address them?
I think that our current countywide system is a great system. There are 4 things that I would propose going forward. First off, the contracts that we have 3 contracts for countywide EMS right now with the Amherst Fire District, the City of Stevens Point, and now the Village of Plover. Those are all up for renegotiation this year because they'll end at the end of 2018, so for renegotiating to start a new contract 2019. So I think one of the first things that I would do is, as we start that renegotiation of those contracts, is incorporate someone from the rural area, from the townships within that renegotiation. We've heard that they would like a bigger voice in that process because they also want to be included in the quality of that service. We did put forth through the County Executive Office a survey to all of the municipalities. The due date for that is actually tomorrow, and have been reaching out for them to give their input on how they feel about the countywide EMS system and what they would like to see potentially changed. So I think adding that rural voice when we do the renegotiation is going to be important. In addition to that, we need to cover those 4 corners of the county. And I think as we're talking about these contracts, we need to open up the possibility of bringing in other providers that could better cover those 4 corners, such as Gold Cross in Wapaka County or United Ambulance in Grant County, so we can increase the response times to those 4 areas. Thirdly, I think the community paramedic bill that got put forth needs to be explored here in the county. That has the possibility of having a position that could go out and travel to non-emergent calls and help alleviate some of the ambulance calls. And I think the last piece of that, the 4th piece of EMS would be first responders. The County Executive's Office did put forth in the budget an additional $10,000, raising from $75,000 to $85,000 the reimbursement for first responder groups in order for them to be able to purchase supplies.
Okay, thank you. Chris Holman.
I've spent a lot of time on this issue. The primary reason I've spent a lot of time on it is I think that the solutions are there. It's just that a lot of the, there's the mechanics and the process of government, doing contracts and such like that. But what really is at the core of the issues in this county at EMS are all the personalities and egos that have been involved in pushing things to the brink. We've had 5 emergency management directors in 5 years. There's all kinds of dysfunction everywhere. The city, and the county don't like each other. The city and Plover argue over an ambulance. The towns are upset because they're paying 43% of the levy and not getting the services they're paying for, and so on and so forth. So it's really complicated on the personality side in terms of engaging people and rebuilding the trust that we're going to need to do those sorts of things in terms of, taking care of the system. Right now, there's what I think is a pretty savvy move in moving the Emergency Management Division to the Sheriff's Department and moving the EMS specialist under Chief Deputy Contos. And the reason that that's a savvy move is that it takes the oversight out of the County Exec Office directly as it has been. So it provides, in my opinion, a stronger oversight for that position, which is going to be good moving forward. The other piece is that Chief Deputy Contos is like kind of an ideal candidate for this sort of thing. He was the Chief of Fire Department in Whiting for quite some time. And so he's familiar with the emergency management sort of planning, the mindset that goes into, looking at what is EMS up to, what is emergency management doing. And so by splitting them, keeping EMS under the chief deputy, and finding somebody who can get into that emergency management division and work on the broader issues like storms, tornadoes, all these other things you never want to have happen. That will be a huge push in the right direction in terms of starting the conversation over and hitting the reset button so that we can enter the room, sit around the table, and come together to do everything that they're talking about.
Thank you.
It goes fast.
Yeah.
And finally, Matt Jakowski on this question.
Sure. First and foremost, we can't afford not to be in a countywide EMS system. It just won't work for our townships if every township, every village, every city has to contract themselves. It's not fiscally responsible to get rid of a countywide EMS system. One thing I have to do is I have to actually thank our first responders, and if there's any of you in the crowd here tonight, thank you. Because out in the rural areas, if it wasn't for first responders, we wouldn't send an ambulance, we'd send the coroner. 43 minutes to response time out in the town of Belmont. That's with an Amherst ambulance. 43 minutes. A lot happens in 43 minutes. There are some ways to solve these problems. One of the problems that some of the locals tried solving themselves, the town of Belmont came forward with a proposal. They were going to contract themselves with Gold Cross Ambulance. It was kind of a minuscule amount that it would have cost them to have 15 to 20 minute service. The county executive's office decided that that wasn't the right way to go, wouldn't allow the town of Belmont to do that. There are ways to do things though. Our Amherst ambulance currently responds over into the Iola area for Wapaka, for Gold Cross, through a mutual aid agreement. I think we need to look at mutual aid agreements in those remote areas of the county. If there's somebody that can get there quicker, why aren't we working with an agreement for them? Minutes save lives. We all know that, and we all know that people that pass away don't pay taxes.
All right, thank you. We are going to move into our closing statement time as forum is coming to a close. This minute-and-a-half closing statement is an opportunity for the candidates to comment on topics not covered in the questions. And again, the order will be by drawing. And our first will be Chris Holman.
Okay, first of all, thank you all for coming out, and thank you to the league for hosting. I'd like to encourage you all to continue to ask the questions about what we've talked about tonight, and there's several other issues we haven't even got into. These snapshots of perspective are helpful in a forum like this, but what I found after several months of intense research and meeting with community members, organizations, and people at every level of county, city, village, and town government is that there's always a complex feature of a given issue that is hard to fully appreciate without that longer, more nuanced conversation. So the media is doing the best job that it can, but the guts of these issues don't end up in the spotlight very often. So the nuance is important because without it, we only have a glimpse of reality. And your participation in the process, even if it's simply through inquiries, will help to better inform the public and to provide a sharper focus to the transparent processes of county government. In other words, we are running for office, but the county needs you too. There's also something important that I want you to realize about the position of county executive, at least from my perspective. On the big issues of the day, he or she can't do anything on their own, so I will make this promise. The time and energy that I put into being your county executive will be focused on making timely decisions, providing the leadership and guidance that people want, setting priorities, and holding us all accountable to what directions we decide to head in. I will lead us forward and strive to decrease the frustration that's being felt in the county, and I will push us to act so that we do not increase the costs, both fiscal and personal, of doing right by the people who are in the county now, but also those who will be in the county in the future. Thank you.
Thank you. And our next closing statement will be by Jamie Gabert.
Thank you. I want to say thank you again to the League of Women Voters for hosting tonight, and community media, and for everyone in attendance. I agree that 2 minutes is a very short time frame in order to answer these questions. All of the candidates have websites and Facebook pages, and all of us have information out on the table for you to reach out with us to us and learn more information. Someone recently shared a quote with me by President Theodore Roosevelt, and it was, "Far and away, the best prize that life has to offer is the chance to work hard at work worth doing." And I smiled when I heard it because for the past 8 years, my time in public service with Portage County has been the most rewarding experience of my career because I have worked hard at work worth doing. I hope that my answers tonight demonstrated my desire to continue to be of service to Portage County. My experience means that we don't skip a beat. With a heart full of service and a mind and a head full of county knowledge, we start work on day one, real work on day one. Thank you again for the opportunity tonight. And while I know everyone in this room is voting on February 20th because you came out to listen and hear what we had to say, I really encourage you to grab a friend and also take a friend to the polls with you and vote on February 20th. Thank you.
Thank you. And finally, Matt Chakowski.
Thank you, everybody in attendance. It's great to see this amount of people to come out for a forum here in Portage County. I don't know if I've ever seen this many people in one room for to talk about county issues. That's what we need. We need involvement from people. And maybe as a county board supervisor, maybe I haven't done a good enough job to get you involved, but I try. I'm out there in my district. I talk to people. I want to hear what they say. When I talk to other members of the county board and I say, well, I talked to so-and-so about this and they felt that way. I talked to this gentleman about this. I talked to this lady about that. They look at me and say, well, no one ever calls me. No one ever talks to me. It's my job, will be my job as county executive to get out and talk to the people. There may be an office in the annex that says county executive, but that's not where the county executive belongs all the time. The county executive needs to be out among the people, out in the districts, out in the far reaches of the county to hear what the people have to say. We need to do that to open a transparent government. You need to know what's going on in the office of the executive. I need to know what's going on throughout the county, and that's what I will do. I will treat this as my job. I will put 100% into it. I'm going to have to leave my lifelong passion of farming to become an executive, but I'm willing to do that because I'll still be there as a placeholder for my son. Thank you.
Thank you. Thank you to the candidates for their time and energy they have invested in running for the Portage County Executive Office and for participating in this forum. Feel free to stay to talk with your constituents. However, we do ask that if you want to do that, you do it in the library because we have another forum coming up here shortly and we need to set up for that. Be sure to stop at the candidates table if you're interested in the candidates' literature. On February 20th, primary ballot, Portage County voters will also be voting for several national, state, and local offices. The League of Women Voters has a candidate guide for national and state elections, which may be found at vote411.org. And also League contact information, including our website, email, and mailing address is available at this table. This concludes the forum for the Portage County Executive. Thank you, candidates and audience, for your participation. We also want to thank John Quirk, who taped and will replay the forums on Community TV, Channel 984. And the times of those are February 16th, Friday evening at 8 p.m., February 17th, Saturday at 1:30 and 9 p.m., and Monday, February 19th at 5 p.m. And they will also be on the StevensPoint.com website soon. These broadcasts are an appreciated service of the Portage County area residents. So we thank all our league volunteers, we thank the library for hosting us, and we believe that when you vote, you are participating in one of the most basic and important responsibilities you have as a citizen. When you vote, you are empowering your political voice. Please remember to vote on February 20th, primary election, and also the April 3rd general election. Your vote does count. Now let us show our appreciation to all the candidates.